Welcome to The Explainer. Today we're tackling a topic that's a literal game changer for so many of you, hip replacement recovery. We're going to take all that dense, gold standard clinical guidance from the American Academy of Orthopedic Surgeons, the Mayo Clinic, and Medline Plus, and distill it down into a super clear, easy to follow roadmap. Let's get right into it. Okay, let's dive into this. We've broken this journey down into 4 chronological phases. First, pre-surgery home preparation. Second, immediate post-op care. Third, returning to daily activities. And finally, your long-term joint health. Starting right off with phase 1, pre-surgery home preparation. Now, you might be thinking, doesn't recovery start after I wake up from anesthesia? Well, actually, according to the Mayo Clinic, a truly successful, stress-free recovery starts weeks before you even set foot in the hospital. Setting up your home base is just as crucial to your outcome as the procedure itself. So we're looking at 3 big steps here. Number 1, clear those walking paths. Get rid of throw rugs, tuck away rogue power cords, and just make sure there's a nice, wide, unobstructed lane through your living spaces. Number 2, build yourself a recovery zone. Think of it as command central. You want your phone charger, the TV remote, your meds, and a big glass of water all within easy arm's reach of a firm, comfortable chair. And number 3, install bathroom safety items, like grab bars and an elevated toilet seat. Doing this now, it's a massive stress reliever later. I mean, imagine trying to navigate around a bunched-up rug while figuring out a brand new walker. No thanks. Taking care of the whole shebang ahead of time gives you absolute peace of mind so you can just focus on healing. Moving right along to phase 2, immediate post-op care. All right, so this phase covers those critical first days and weeks right after your surgery, and we're leaning heavily on instructions from Medline Plus here. This is when your body is doing the absolute heaviest lifting of the initial healing process, and honestly, how you choose to move matters immensely. The main thing we're trying to avoid is called hip dislocation risk. Basically, this is the period immediately following surgery where specific movements absolutely must be avoided to keep that brand new joint securely in its socket. You see, while the prosthetic hardware itself is incredibly strong, literally built like a tank, the surrounding muscles, ligaments, and tissues that normally hold everything tightly together were manipulated during the surgery. They need some time to heal and regain their natural tension. So during this critical window, certain angles and twists are simply off limits. Now, what's really interesting about these seemingly strict, clinical-sounding instructions is how easily they actually translate into simple daily habits. There are few golden rules to internalize here. Do keep your feet facing straight forward when you walk or sit. Don't cross your legs, not even casually at the ankles while you're relaxing and watching TV. Don't bend your hips past 90 degrees. So that means no leaning way forward to tie your shoes and no bending deep to grab a dropped magazine off the floor. And finally, do use firm, elevated chairs instead of sinking into that plush, low-to-the-ground sofa. Avoiding a 90-degree bend really just boils down to changing the mechanics of how you sit down or put on your socks. But it is the exact science you need to follow to protect your new hip while it stabilizes. And this brilliantly illustrates your physical progress, which actually follows a highly predictable timeline. During weeks 1 and 2, you're going to be relying on a walker or crutches. The focus here is strictly on balance, letting the bones securely attach to your new implant. Then, by weeks 3 and 4, most folks transition to a cane. You're going to be feeling significantly more confident and balanced by this point. And by week 6 and beyond, well, you're generally looking at resuming independent walking without any mobility aids at all. Seeing this timeline is a fantastic reminder that the walker isn't a permanent fixture in your life. It's just step 1 on a very well-trodden path to getting your full independence back. Which brings us to phase 3, returning to daily activities. This is where we shift our focus to the AOS guidance. And let's be real, this is the entire reason you're having the surgery in the first place, right? To get back to normal life and the hobbies you love, without that constant grinding joint pain. Looking at the safe category, things like walking, swimming, and dancing are fantastic, low-impact ways to stay active once your doctor gives you the green light. Then we have the proceed with caution activities. Think golf or cycling. You can absolutely still enjoy them, but you might need to tweak your golf swing a bit or stick to a stationary bike at first just to make sure you aren't twisting too sharply. And finally, the avoid category, high-impact sports and jogging. The repetitive, heavy pounding of running just isn't worth the accelerated wear and tear on your implant. Trust me, there are plenty of wonderful, healthy ways to stay active and enjoy your brand new mobility without all that high impact. And that leads us perfectly into our final phase, phase 4, your long-term joint health. So imagine you've made it through the surgery, you've completely conquered the rehab timeline, and you are fully back to living your life. How do we protect this incredible physical investment? I mean, a hip replacement is truly a marvel of modern engineering, but we want to make sure it lasts for decades to come. So the crucial point is this. Maintaining a healthy weight and staying moderately active are the absolute keys to reducing daily stress on your new joint. Think of it like a physics equation. Every extra pound of body weight puts a multiplied amount of force on your hips with every single step you take. By actively managing your weight with a healthy diet and consistently engaging in those safe activities we just talked about, like a nice swim or a brisk walk, you are actively extending the lifespan of your prosthetic hip. It's an ongoing daily commitment to your overall health, but man, it pays massive long-term dividends for your joint.
As we wrap up all this core information, I really want to leave you with this reassuring consensus directly from the clinical data. It states, hip replacement is one of the most successful operations in all of medicine, offering significant relief from pain and improved quality of life. Just let that sink in for a second. When you're busy prepping your house, it is so easy to get bogged down in all the strict rules, the grab bars, and the physical therapy timelines. But the big picture here, it's overwhelmingly positive. This procedure has a phenomenal, proven track record of literally giving people their lives back. It is a highly successful, completely transformative step forward.
Which brings us to our final question for you today. What is your first major goal for your new hip? Is it walking your daughter down the aisle? Is it finally playing a full 18 holes of golf without wincing in pain? Or maybe it's just effortlessly keeping up with your grandkids at the park on a sunny afternoon. I want you to envision that specific success clearly right now. Keep that image crystal clear in your mind. Use it as your driving motivation through those challenging first few weeks of physical therapy. And definitely be absolutely sure to discuss these specific activity goals with your orthopedic surgeon so they can help tailor your recovery to your exact dreams. Thanks so much for joining us on The Explainer today.